All right, let's talk about testosterone replacement therapy, or TRT. You've probably heard about it, right? It's everywhere in men's health discussions, and it's surrounded by these incredible, life-changing stories on one side and some pretty persistent controversies on the other. So, what's the actual deal here?
You hear things like this from a man in the UK on the treatment, and that right there, that statement, it really captures the whole promise of TRT. It's not just about feeling a little bit better, it's about feeling like you again. This is the human side of the whole conversation.
So, beyond those powerful personal stories, what is the hard evidence telling us? That's what we're going to do right now. We're going to cut through all the noise, dive into the actual research, and try to uncover the real story of testosterone replacement therapy.
You know, for most guys, this whole journey doesn't just start with a clear diagnosis. It's not like a switch flips. It begins with what you could call a slow fade, this gradual, kind of confusing feeling that something is just not right.
And just think about the real-world impact of that for a second. It's not just about being tired. It's about your entire world starting to shrink. It's when you start saying no to things you used to love, because you just don't have the gas in the tank anymore.
And it's never just one thing, is it? It's this whole collection of issues. We're talking a deep, chronic fatigue, a mental fog that just kills your motivation, a libido that's nowhere to be found, and then the physical stuff, gaining weight for no reason, or hitting the gym and seeing zero results. These things fundamentally change how you experience your life.
But, okay, you're feeling all these debilitating symptoms. Getting from that point to an actual concrete answer, well, that is often its own long and, frankly, frustrating journey.
And this quote, this captures a problem so many men run into. Their own experience of feeling awful clashes with a system that's often just looking at numbers on a page. Being told you're technically fine when you feel anything but, well, that's a huge roadblock to getting help.
And all that frustration, it leads to this. This number is just staggering. A big UK survey found that 86% of men who have these symptoms wait for at least 1 year before they even get any kind of care. 1 full year.
And believe it or not, it gets even more concerning. Almost a quarter of these men wait for more than 5 years. Just imagine that. 5 years of living with that slow fade, feeling dismissed, and just not knowing where to turn for help.
But for the guys who do push through, get that diagnosis, and start treatment, the story can change completely. So let's flip the script and look at what the clinical evidence actually says about the benefits of restoring that hormonal balance.
So, where do the changes start? Well, for a lot of men, they see it and feel it physically first. Remember that frustration with not being able to build muscle? TRT tackles that head-on by helping to rebuild the body's entire foundation.
And look, this isn't just wishful thinking. The gold standard of medical research, randomized controlled trials, they're incredibly clear on this. Proper TRT leads to a significant bump in lean muscle and a drop in body fat. In the real world, that means more strength. And just as important, it boosts bone density, which is absolutely vital for staying healthy and active as you get older.
But the benefits go deeper than just muscle and bone. They extend into your metabolic health. And this is a huge deal, because we're talking about the systems that are directly linked to your risk of things like type 2 diabetes and heart disease.
And, yep, you guessed it, the clinical trials back this up too. We see that TRT helps the body use insulin better, which in turn helps lower key blood sugar markers. It can also improve your cholesterol numbers and help reduce waist circumference, which is a great sign that you're losing that dangerous internal fat. But the changes are absolutely not just from the neck down. Your brain is loaded with testosterone receptors, so it makes sense that restoring your levels can have a massive impact on how you think and feel.
This is exactly why you hear guys on TRT so often say they just feel better. And the studies confirm it. We see huge improvements in mood, energy, and that general sense of vitality. There are even some modest bumps in cognitive skills, all of which adds up to a seriously improved quality of life. Okay, so let's tackle the big one. The question that's probably been on your mind this whole time. Is it actually safe? For years, TRT had this shadow hanging over it, especially when it came to heart health. It's time to separate the old myths from the new reality.
You can really see how the science has evolved here. The old fears about heart attacks and strokes, they came from early studies that we now know were seriously flawed. The new evidence from massive, well-designed trials tells a completely different story. When it's done right, prescribed correctly, and monitored, TRT does not increase the risk of major heart problems. And get this, it's not just about a lack of risk. A major recent study took it a step further. It found that in a high-risk group of men, being on TRT was actually linked to a nearly 50% lower rate of dying from any cause. So far from being dangerous, for some men it was actually protective.
So what does doing it right actually mean? Well, it all comes down to smart medical oversight. The most common side effect, a high red blood cell count, is easily managed with regular blood tests. As for the prostate, modern data is clear that TRT doesn't cause cancer. And finally, and this is crucial, it's not a one-size-fits-all treatment. It has to be tailored to you.
So when you pull it all together, the science, the safety data, the patient stories, you start to get a really clear picture of just how transformative this can be.
And this is what it looks like from the perspective of the guys who are actually on it. In a survey of over 900 men on TRT, a whopping 85% said their treatment was either effective or very effective. That is an unbelievably high success rate from the patient's point of view. And this last quote, man, it just gets to the absolute heart of the matter. For the vast majority of men who genuinely need it, TRT isn't about trying to be a bodybuilder. It's about getting back to normal. It's about finally clearing that fog and just feeling like yourself again.
Which leaves us with a pretty big question, doesn't it? When you have evidence pointing to these kinds of profound benefits, physical, metabolic, and mental, and the latest safety data is this reassuring, isn't it finally time we change the entire conversation around men's hormonal health?